Hi, thank you for joining us today. My name is Adrienne Griffith. I'm the clinical director here at Southeastern Plastic Surgery, and I'll be your moderator tonight. We are live streaming on Facebook as well as YouTube. This hot topic will be saved so you can watch it again later and you can share it with friends if you find it interesting. We would love for you to submit any questions that you have about the subjects tonight. We will address them at the conclusion of tonight's topic. You can also submit them through our patient portal and we can respond to you that way as well. So let's get started. Today's hot topic will provide you with answers to our most commonly asked questions about injectables. I would like to introduce you tonight to Dr. Ben Curbo. He's the founder of Southeastern Plastic Surgery and has been practicing for over 20 years here in Tallahassee, Florida. We are very excited and proud to be able to share with you this exciting news that Southeastern Plastic Surgery has been recognized as a diamond practice by Allergan for both the highest volume of patients and the best injectable care in the entire North Florida, South Georgia Panhandle region. Again, we would love for you to submit any questions. Keep a little note tablet handy as they come up, and we will address them for you at the end of tonight's topic. We know that there are many myths about facial injectables, fillers, and neurotoxins, and we'd like to explore those for you today, and have Dr. Curbo go over any misconceptions and myths you may have heard. Let's get started by explaining the differences between neuromodulators like Botox and Dysport and Xeomin, and then fillers like Juvederm and Restylane. Dr. Curbo, would you like to start us off with explaining what exactly are neuromodulators?
Yes, Adrian, thank you. So neuromodulators are a term for natural and manufactured chemicals or substances that affect receptors of the nerves, if you will, speak to the nerves or speak to the muscles or transmit messages to the muscles. There are a lot of natural neuromodulators in the body, such as dopamine, epinephrine. So some of these things you may have heard of, but for our purposes, we're talking about chemical neuromodulators that we use to affect muscle movement. So a neuromodulator, especially things such as Botox, are substances or chemicals that attach to the receptors of the muscle that inhibit it from movement, partial or complete movement. Neuromodulators, depending on what part of the body, natural neuromodulators can last seconds or minutes, or in cases such as Botox, those neuromodulators may affect the muscle for months.
Very good. Now, moving on, can you explain now the difference between neuromodulators and fillers? I know a lot of people come in and say, I need some Botox here to fill this crease. So can you explain to us what fillers are and what they accomplish?
Yes, a filler is exactly what it sounds like. It is a product that's used to fill a space, whether that be a fine line around the lip or a deeper fold in the cheek or a moderate size line in the forehead or between the eyebrows. Fillers do exactly that. They just fill. They're not, they don't affect any dynamic movement of the face or a muscle. So many times when we have a muscle moving back and forth over time, that combined with environmental damage, we may end up with a crease or a wrinkle. And that's where a filler is used to fill that in. Nowadays, there are a lot of different fillers that we use to fill different spaces, whether it's deeper fillers for larger volume, such as if you think of it as a foundation in a building, or fillers that are used for superficial lines, If you think of that as, sort of applying putty or something in a crack in the floor and the wall. So fillers are exactly what they sound like. They're used to build or fill a space.
Okay, good. So I think that pretty well covers, a basic explanation of both of those for folks. Um, I've got a question here that's been submitted, and it is, will Botox give me a frozen or expressionless look?
I think that's a good question, and that's a question that a lot of people act, and people that often may decide whether they want to use Botox or not. I think it is a complete myth that Botox will always give you a frozen face or an expression look. Botox will relax the muscles that are being treated. And in some instances, it can stop any movement of those muscles. But in general, with our patients and the patients that we see, the desire to have no movement of the muscles at all is not there. And so that response to the Botox or the neuromodulator is really in the control of the volume and the amount of Botox you use. We have some slides here that we have pulled up, I think, that demonstrate this very well. These slides show the person in a before and an after, where they're really trying to give an expression. And you can see if that face was frozen, the face would be the same. But what you do notice on the slide here, on the upper after result, she's able to raise her eyebrows, but you notice that deeper line in the mid forehead is gone. That's because the Botox that was used at this time was enough to eliminate that wrinkle, but not enough to compromise lifting her eyebrow. In the lower photo of her before and after, it shows her really frowning to show her glabella lines, or the lines in between her eyebrows. And you can see there are some lines still there in the before. In the after, when she's really trying, she can produce a little bit more of those lines, but there's still minimal movement of that brow, causing those lines to be significantly deep. On this next patient, you see just her forehead and her glabella lines, or what we all call the 11 lines, were treated. In the upper photograph, before, she's really trying to raise her eyebrows, and you can see her eyebrows come up, but also you can see the wrinkles and lines in her forehead. On the after, her eyebrows come up, but you all see that those lines and wrinkles in her forehead are now gone. In the bottom before or after, she's really trying hard to show those squint lines. And once she's been treated, you can still see the look of her frowning, but the depth and extent of her frown lines are much less. So in those examples, they've gotten Botox, they've eliminated some of the fine lines that they don't like, but they're still able to show expression.
Very good. On to myth number 2, Dr. Curbo, and that is that injectables are painful. How would you address that myth?
Well, I mean, that's a little bit an interpretation of the person who's receiving the treatment. But in general, when we discuss pain with patients after using fillers or Botox, it is very well tolerated and minimal, especially with the Botox. The fillers sometimes do require a topical anesthetic to help decrease some pain, but in general, these procedures are pain-free or minimal pain, and certainly people can return to work, they can drive home, they can go out that evening, and really don't require any significant pain medication or anything.
Good, excellent. So, on to a very timely myth number 3 is, can I get Botox or filler if I've recently had my COVID vaccine?
Well, that's a question we've been getting a lot in the last year or so. And there actually have been some studies done with the Moderna vaccine, where there were very few cases reported of some peri treatment swelling that resolved. There's really been no evidence of any significant short-term or long-term sequelae with getting fillers or Botox along with the vaccine. Now, our general recommendation would be you would like to give it about 2 weeks time frame, either 2 week before you get a vaccine or 2 week afterwards. That's the recommendation at this time. But again, there has been no concrete evidence that there's any long-term or short-term effects with the fillers or Botox and any vaccine.
Very well, very well. Thank you. Myth number 4 we'd like to address is once you stop using injectables, once you start using injectables, you can't stop or all your wrinkles will either return or get worse. How would you address that?
Well, I wouldn't say I would say that's not true. Now, I always joke with my patients when they come in for Botox, and I tell them, if you don't want to do it for the rest of your life, don't do it the first time, because you're going to like it and it's going to work and you're going to want to repeat it. That's just a joke I tell, but in some ways it's a little bit true because it is such a good product. What I have found anecdotally with fillers and Botox is if you stop using them, some of your lines and wrinkles will come back because they were there to start with, and that's what those fillers and Botox are used for. With Botox, what I've found is that repeated use of Botox in a muscle, I think, this is my opinion, that the long-term effect with that Botox, if you stop, will still be beneficial. And I think of it like if you put a cast on your leg and you don't use it for a period of time, that muscle sort of atrophies. It's not as strong. If you use Botox and some of the lines and wrinkles caused by muscles on your face and you weaken those muscles over time, I see them as sort of weakening themselves and they're not as strong. So we know that these lines and wrinkles won't come back worse if you stop, but I would never say that you won't, some of the lines and wrinkles won't come back, but it certainly doesn't make them worse when you stop.
Very good. Yeah, we can't stop the clock forever, can we?
Exactly.
All right, on to myth number 5, and that is filler doesn't look natural and you can always tell when someone's had it. How would you address that?
Well, I think that's unfortunate that people think that, and it probably stems from so much of what we see on social media and television, and even just walking around sometimes in a community where, like any product or any treatment, it can be overdone, and what people want is not always what is not always the best scenario for everyone. And so, in my opinion, that has a lot to do with the patient's preference and the person who's treating them. There's no doubt that fillers done properly can look very, very, very natural, and no one would be able to tell you'd had a filler in unless they had a pre-treatment and post-treatment photographed in front of them. Unfortunately, a lot of people want to have a filler, I think, overdone, but that is at the choice of the patient and the choice of the injector. In our community, in our demographics in Tallahassee, we found most patients don't want to look unnatural. They want to look natural. And that's the beauty of a filler, is in the proper setting, it can really enhance someone's features without over enhancing them and looking unnatural. A perfect example is in this photo we have of this patient's lips. I, just like anyone else, walk down the street and see people with their lips injected and go, oh my God, but this is our typical patient, this young lady who has nice lips to begin with. She feels like her upper lip is a little thin. And so just a little bit of filler is applied to the upper lip to balance that out. a little bit was put in the lower lip, because we always want the lower lip aesthetically to be slightly larger than the upper lip. So if you look at that patient in the after photos, to me, she looks very natural. She has a very natural and youthful look to her lips. And one wouldn't think passing her on the street or in a conversation with her that she had had lip fillers.
Very nice balance.
I think that's the only photo we have of that. No, we have one more photo.
Yes.
This next patient, you can see very similar. Again, she has a before and after photo. One are fillers in sort of the glabella area, and one fillers in the lip area. Again, has nice full lips to begin with, wants a little bit enhanced. As we age, the lip thins a little, and you can see from the standpoint of the forehead and her lips, she has a very nice balance to her lips, looks very natural. And again, in the conversation or a picture or walking down the street, you wouldn't look at that person and think they'd have fillers. Again, a lot of that is the patient preference and the injector who understands the aesthetic balance of many of the facial features. Even if you put a little filler in someone's lips and you make the lower lip bigger than the upper lip, it's going to look unusual to people. They may not look at it and say, wow, that lower lip is larger than the upper lip, but there will be something that will be off balance. So it's very important to have the right person guiding you when you decide you want to get a filler.
Agreed. All right, now we will move on to myth number 6, and that is injectables require too much maintenance. What would you say to that, Dr. Curbo?
Well, I guess it's the definition of what too much maintenance is. There's no doubt that the majority of injectables are not permanent. I tell patients that's sort of a good and a bad thing. If you don't like it, it's going to go away. And when we talk about operative procedures in plastic surgery, if you don't like it, that can be a problem, or if we have a bad outcome. But with fillers and Botox and injectables, they are going to resolve with time. So they do require a certain amount of maintenance. The nice thing about fillers that has happened and evolved over the last few years is the quality, the longevity of fillers have gotten better and better. And so maintenance with fillers has been less and less. Most fillers are injectable or neuromodulators are going to require an injection every 5 to 6 months with the neuromodulators, to sometimes up to 3 years or so with the fillers. So to me, that maintenance level is not that much when you consider, we go in and get our hair cut, a couple times a year, or we do other things to help maintain other areas that we're concerned with. So it does require some maintenance, but in my mind, not too much maintenance.
Very good. Now, here is myth number 7, and this one seems to come up a lot, so I think it's very good we get to address it tonight, and that is Botox is dangerous.
Well, Botox has been around for a long time. It's been used in aesthetics or for cosmetic reasons for over 20 years. And before that, probably 20 years in other medical issues that require a neuro modulator. So Botox itself has been around a long, long time. The Botox that we use is formulated that it is a very small amount that affects just the receptor of the muscle that you're targeting when you put the Botox in. There's no way to inject enough Botox to affect someone systemically, and there's never been a reported case of that. Matter of fact, there's really never been any reported cases of any significant complications related to Botox use in cosmetics when it's used correctly. Um, Complications like local complications, people can have a little bruising or maybe a little pain at the site. And sometimes if that is not injected in the proper position, it can affect another muscle you don't want. But to
Mhm.
have any kind of systemic or significant problems that would be life-threatening or health-threatening with Botox has just not have never been reported after millions of injections of Botox.
Excellent. Thank you for that answer. On to myth number 8. Botox can only be used once lines begin to appear.
Well, I mean, I think that I would consider that a myth. You remember, Botox is used to relax or stop the movement of underlying muscles. Those underlying muscles over repetitive use over the years is what cause our lines, the frown lines between the eyebrows, the smile lines around the eyes, the vertical lines around the lip. Those are all areas that can be affected by that muscle movement over and over again. So once that Botox is started and we stop that movement, the line many times will disappear. I personally believe that using it pre-line appearance will help slow the development of that line. So I think if someone is really serious about trying to prevent deeper lines in the forehead or in the frown line, beginning that Botox treatment at a younger age or just as those lines slowly begin to appear is probably helpful. The nice thing too is, when you don't have much strength or movement in those muscles that are causing the line, or the line hasn't developed, you generally don't have to use as much of the Botox from the standpoint of the units. So I think starting that Botox at a younger age is very preventable from those lines that can be produced from long-term movement of those muscles.
I think, don't you find that in our practice, our patients are coming in younger and younger as well because they're learning that prevention is key rather
I,
than addressing the problem once it arrives?
I think you're right. I just think we see younger and younger patients opting for skin care because they are
Mhm.
understanding, and we are understanding that prevention of those sunspots, elimination of those sunspots, exfoliating the skin, all those things are going to help prevent changes in aging of the skin. It's going to help prevent, early skin cancers. And the same thing with the Botox, preventing some of the exaggeration of those lines in combination with environmental damage. You can really slow that process down.
Very good. Very good. I think that kind of wraps up our myth section. And what we're going to do now is take questions and comments online. I will be reading those as they're handed to me, Dr. Kerbo, and we'll let you address those. Okay.
Okay, I got it.
First one here is, can a person develop an immunity to Botox? It's a good
Well,
question.
that's a good question, and I don't know if I can completely answer that, and I don't know if I have the perfect answer. We do seem to think that some people may respond to Botox a little different anecdotally, even over time. And we have different neuromodulators to substitute, such
Mhm.
as Dysport and other ones, if we think the Botox isn't working as well. Uh, I don't think it's an immunity. I think it's probably um, a weakening of that muscle, and the result of the Botox just isn't as apparent to the person. So I don't know if it's immunity, but I do think there are some patients anecdotally that we think it seems to not work quite as well with, and what we've done with those is usually switch them to another neuromodulator, and it seems to work pretty well for them.
Good, good. Now, another one you kind of addressed, but since someone submitted the question, I think it deserves another answer here so people are very clear about this. Is, can Botox cause permanent nerve damage?
There's no evidence at all that a Botox injection can cause permanent nerve damage. This is a neuromodulator that really doesn't affect the nerve itself, the receptor on the muscle. And we know that that is a temporary process. And once that Botox that's on the receptor of the muscle is diluted and the body is taking care of it, the function of the muscle will come back. So there's never been, in my knowledge, a reported case of Botox causing any type of permanent nerve injury. Matter of fact, if someone is using Botox on you, let's say they're injecting your frown lines between your eyebrows, and for some reason they inject a little too low, a little bit of Botox seeps down and affects one of the muscles that raises your eyelid. You may notice that your eyelid is a little weak and doesn't raise as well. We know in those patients, we would call that a complication, a local complication. But we know because it's such a small amount that has usually made it there, that complication or that will improve usually within a few weeks.
Right. Very short-lived. Okay. I've got another one here for you. I've never seen this question. Do fillers stretch your skin?
Well, I don't think they really stretch your skin. They're sort of filling, filling volume underneath the skin, or filling that space. So I don't really, the skin is already there. I don't think they work by stretching as if you got your hand and pulled your face and it would make a wrinkle go. It's really replacing volume to the face, which we know after the age of 35, we begin to lose volume in our face. And so I don't think it really stretches the skin more than sort of filling volume to allow the skin to redrape better.
Very good. I think that's all the questions we've had submitted thus far. However, I do want to remind all our viewers that you can still send them in, type them in on the chat. We have a patient portal. We would be happy to address those. We can reach out to you individually. And of course, we're always happy to bring you in for a consultation. Couple announcements that I have for you, and that is, I'm going to read this so I get it right. Our holiday season is approaching, and it's a special time. We usually do an open house here at Southeastern Plastic Surgery. We love to express our gratitude every year for the loyalty, the patients that come back to see us, the patients that refer their family and friends to us. We're very, very thankful for that. So, keeping that in mind, we're very excited to let you know about a new twist that we have for a long-standing open house. We do want you to mark your calendars now. It'll be very important. Starting on November 29th and for the following 12 days, we are going to celebrate our patients and our community with 12 days of holiday treats. You do need to subscribe to our newsletter and our website, because we will be putting out e-blasts, giving you important dates and details. Make sure you follow us on social media. You can go to www.se-plasticsurgery.com. That's a good place to stay in touch with us, get all the latest news on what's moving and shaking here at Southeastern Plastic Surgery. And of course, you can submit questions there as well, and we'd be happy to reach out and speak with you. Thank you so much for joining us tonight, and we look forward to seeing you again real soon. Bye.
Thank you.